working on a hamstring injury. Hamstring, groin with the Hipflexor. He's an MMA fighter, so rolling around on the mat, kicking. So he has some muscle injuries. So what we're working is we're gonna work the hamstring, the sartorius and gracilis muscle, then up into the hip flexor, and we're going to be doing it while he's balancing on an I-joy board, so it's stabilizing. So it's going to work proprioception along with balance, and as we work the muscles. So we're going to try and get in here and work this, and I'm going to have him go through some half squats to isolate and work the muscle and get them to fire. Go ahead and come on down. So we're working down in the hamstring all the way down, tie-in, then all the way up into the glute. And come up, nice and easy. We're working that, come on down. Just try to work this. Just break up some tissue. Allow them to kind of get the muscles to fire. And come on up. Come on down. As we're working this injury. It's important that we want the proprioception to work rather than just heal the muscle. We want it to be able to fire and work at the same time that the other leg is working that's not injured. Come on up. Come on down. So we're going to work this for just about another 30 seconds. Come on down. And we'll work into another part of his injury. Come on up. Okay, now we're working into his abdominal, a little bit of the upper hip flexor psoas muscle. Can't really deep muscles, so we're just going to work the outer layers to see if we can work into it. We've been working this abdominal area, and he says it's been helping and loosening up quite a bit and allowing him to have a little bit more freedom with his leg motion and his punching. So we're working through here. So we're going to work this for about 45 seconds. We're going to actually then kind of move on to the ball and work in a stretch position. Alright, so just kind of getting in here a little bit, allowing them to get a little bit more stretch to the muscles we're working this. I'm using the GT4 right now. I'm going to move on to the, maybe the small one, GT3. Just kind of work a little bit more across the muscles. Abdominals laying, lateral position. They crisscross on the sides, so just try and get in between them a little bit. And I'll have them kind of do a few abdominal ups. Go ahead and come on up a little bit. As we work the muscle and then back down. Then come on up. Just that way I can see the muscle, I can kind of follow in between the grooves and kind of get in between the fascia part. Come on up. These little muscle grooves. And we'll want to follow it up with some stretching. We're just finishing up the abdominal area here on this side with some proprioception as he's doing an isometric with his stomach muscles. So working that as we're doing Graston on this area. And what we're trying to do is bring everything together strength-wise and with his proprioception. And then he'll continue to do his stretches and do his home exercises. And we'll repeat this in about a week. And we'll go from there.
Hey, I've been doing Graston treatments with Dr. Workman now for a few months. Seen some serious results. It's helped me out a lot in my athletic performance. It's really loosened up a lot of muscle tissue that's been clogged up. it's really good for accelerating the healing process with damaged muscle tissue, which is something I've had some problems with, and Dr. Workman has helped me out a lot with it. So I would definitely recommend Graston treatment to anybody having any kind of muscular issues that's pulling on your posture, making you a little bit weaker than you could be. I would definitely recommend it.